Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello and welcome to Your Health Matters Let's Talk. My name is Cleopatra. Your Health Matters Let's Talk is a program that focuses on priority health issues affecting us in our daily lives. On this episode, we are discussing breastfeeding. And I have in the studios Mrs. Ida Chamamlenga. She's the coordinator of the Infant and Young Child Feeding Program at the National Food and Nutrition Commission. Welcome to the program.
Thank you.
And just next to Mrs. Mlenga is Mrs. Grace Banda Mushiwe, the Executive Director at the International Baby Food Action Network, IPFAN Zambia. Welcome to the program.
Thank you, Cleopatra.
We have a clip that we would like to show you on breastfeeding. Watch this.
Breastfeeding, I think, is the most common or the first mode of feeding for everyone, for every newborn. And in Zambia, we are fortunate that it's a practice which is commonly accepted, and most of the families want their children to be healthy. The importance of breastfeeding, we have a lot of benefits, both for the mother and the child. Let me just mention a few of them. For the baby, breast milk is the first food which is beneficial. It has a lot of nutrients. It has a lot of fluids which are useful for the growth or beneficial to the growth of the child. Breast milk as well contains a lot of factors, especially the first milk, which looks yellowish. I think most of us have seen that. Just after delivery, the mother produces very thick yellow milk. That is the milk which is rich in factors that protect the baby from illnesses. It also actually helps the baby to pass out stool. If we've noticed, the first stool which the baby passes is greenish, and when the milk is given to the baby, it helps clear that green sticky stool, which can be risky to the baby if it stays long in the body.
So when a woman comes in labor ward, she delivers, within the first 1 hour, the mother has to put the baby on the breast so that the milk production starts and the baby gets the first milk which comes out, which is called colostrum. So they have to continue breastfeeding the child exclusively for the first 6 months. If they work, we encourage them to express the milk. Then they store it in a cool place so that even when they are away, those who are home can still continue giving the baby the breast milk.
Ni mwana wayamba uyu, so tizapunzisa na mwametinira kumunyoshera. Pankani yonyosha, mwana uyu wametirina ya wametaona mzukuru wanga hapa, mwena kumunyosha from 0 to 6 months. Osampasa manzi, kumpasa chabe mukaka. Chame chiri mukaka, uyu mwana mukamunyosha, azankara watanzi ya bwino.
Just after I delivered my baby, I started breastfeeding because we've been taught at the clinics that should be breastfeeding our babies with our milk. We're not supposed to be giving them water, any food, until when they're 6 months. I want to give advice to my fellow young mothers who are out there. It's important to breastfeed your baby. Don't rush into giving them food. For example, me, my baby, I've never given her food until when she was 6 months. But she's still breastfeeding. I'll stop breastfeeding and when she'll be 2 years.
Breastfeeding isuma kulina mayo. Elo ukukonsha ukwa mwana pakuti kube bwino kulondoloke kube successful. Kwaliba if mafunde eyo tukonka pakwe batu mwana ala onka bwino ibele ukwabula ubwafya. So nga mwalolesha ichichikopi namona mayo ayi umwana namone fiba mulambalike bwino namone fiba mwigete nina lero lesha kwisa alero amano ni kumwana namumona kwe bati na kwata chirya chimwemwe chakonsha mwamuna So ilo mulewonsha omwana mulekwata n'ekipaale.
Tumukakawako ibeere olakingirako amalwere olina okukula bwina omwana kwabula amalwere ali yonse.
Olofuti kulife bana mayo ni family planning inalengapo ukana okufyala bwangu.
Breast milk is the best food for a baby because it has the nutrients and the protective factors which help the baby grow well. Breastfeeding should be initiated as early as possible, soon after the baby is born, preferably within the first 1 hour, so that the bonding can develop between the mother and the child as quickly as possible.
That was a clip on breastfeeding in Zambia. Let me start with you, Ida. Why is it breastfeeding important for both mother and child?
Thank you very much, Cleopatra. Breastfeeding has both benefits to the mother as well as to the child. If we start with the child, we know that breast milk actually provides all the nutrients that the child needs. And also, apart from that, breast milk is readily available for this child to grow well. And for the mother, we also know that the mother actually benefits from breastfeeding. For instance, we have diseases like cancer of the breast. If the mother is breastfeeding well, those are some of the diseases that the mother will be prevented from having. And the other thing that the mother benefits from breastfeeding, it's cosmetic reasons. We know that when we are expecting as women, most of our tummies, they grow a little bit bigger, and we want to take them back to our normal sizes. There are some hormones that are produced, and you'll find that the mother's tummy will go down through breastfeeding. Apart from that, actually breastfeeding also, there's that bonding between the mother and the child.
Talking of benefits, could you just also explain to us the contraceptive nature of breastfeeding?
In the first 6 months of life, if the mother breastfeeds exclusively, then you'll find that this mother won't return to have menses, meaning that this mother is not able to conceive during this period. So this is how breastfeeding actually helps.
So does that cut across every mother, every woman?
Yes, it does, but the condition is that you need to breastfeed exclusively.
Grace, when should a mother start breastfeeding?
Breastfeeding should start immediately the baby is born. It is recommended that within 1 hour, the baby should be put to the breast. The benefits of putting the baby to the breast within 1 hour is that the baby will have developed the rooting reflex, and the baby will be looking for the mother's nipple. If you delay in putting the baby to the breast, then you are going to confuse the baby and they won't develop the rooting reflex. When you put the baby to the breast within the first hour of birth, the baby will benefit from the colostrum, which is the first milk that the mother produces within 1 hour of birth. And that colostrum goes a long way in giving the baby immunity from childhood diseases. We are talking about diarrheal diseases, respiratory tract infections, ear infections. It will develop the immunity.
How long should a mother breastfeed?
Ideally, and according to the recommendations, the baby should breastfeed for 2 years and above. At 6 months, the baby will have to start eating family foods, which means that the baby from the time it's born up to 6 months should exclusively be breastfed. We should not even give water, regardless of the temperature. We should only give breast milk. You are going to see that the baby is passing adequate amounts of urine. The color of urine is clear, and the baby is passing urine frequently. And the skin of the baby is firm and elastic. You will know that the baby does not get dehydrated even in hot temperatures on breast milk alone. Basically, what we don't want to do is to go against nature. You only do that at your own peril. Nature has provided every mother, unless in difficult circumstances, with 2 breasts. And these breasts, they fill with milk as they are emptied. The more you empty them, the more they are filled with milk. The less you empty them, the less they are filled. If you do not empty them, no more milk comes in the breast. So the principle here is that you should feed frequently and feed from one breast until the breast is empty, and then you take the baby to the other breast, and also that breast should be emptied. Why do we do that? We do that because the milk in the breast is arranged in such a way that there is the foremilk, which is in front, the middle milk, and the milk that is behind. All these types of milk contain different types and levels of nutrients. So if you only feed very briefly on one breast, it means the baby will be deprived of the other two types of milk that are behind the breast. And if you are only feeding on one breast, chances are that the other breast will react by producing less and less volumes of milk, and eventually you get to hear mothers that say, I only successfully breastfeed on one breast because the other breast does not produce milk. It is a condition that we bring upon ourselves because we use the breast less and less.
Grace, are the nutritional levels that you talked about, do they happen frequently, or is it just once in a mother's life?
Apparently, it's every day and all the time that the mother wants to breastfeed. That's why the mother should have time for herself and for her baby before you decide to breastfeed. The mother should be comfortable seated or lying down depending on the age and the size, the weight of the baby. You should have time all the time that you want to breastfeed the child.
Should an HIV positive mother breastfeed?
Every mother should breastfeed from 0 to 6 months, where you do exclusive breastfeeding. When the baby is 6 months, you need to continue breastfeeding until, if I'm HIV positive as a mother, until my child is 12 months. In addition, if I know my status that I'm HIV positive as a mother, I should be on treatment. I should seek medical treatment so that at the point that I'm having my baby, I'm already on treatment for HIV, and then continue breastfeeding up to 12 months. But the 12 months, there's a condition. We don't have just to stop the baby from breastfeeding. We are saying that as a mother who is HIV positive, I should be able to provide a diet for this child that is nutritionally adequate, so that when I stop breastfeeding, this baby will continue growing normally as the one who is being breastfed. If I fail to provide that diet for my child as an HIV positive mother, then it means I need to continue breastfeeding up to the time when I'll be able to provide nutritional adequate diet.
How can working mothers be able to achieve exclusive breastfeeding when they are away from home, even just for a few hours?
Every mother should know to express the breast milk. That is pressing the milk from your breast and keeping it. This expressed milk can be stored in the home just at room temperature for 8 hours. And if you have a fridge, it can be stored in the fridge for 24 hours. If you have expressed probably in preparation for the moments that you'll be away from your baby, you can keep that milk in the deep freezer for 6 months. But how do you feed this breast milk to your baby? Again, we are saying let's not use any other the feeding bottles. We have cups which are easy to clean. Those are the things that we should use when we are feeding the baby on the expressed breast milk. We have the feeding cups. Those are good just to store the milk, not to use it to feed the baby. If you want to feed, remove the top, which has a spout on it, because that spout is very difficult to clean. So you need to feed the baby from the cup, not from the spout.
Aida and Grace, thank you so much. But it is now time for questions from the audience. Audience, are you ready with your questions? Yes. Let's start with the gentleman in specs there.
Does a lactating mother really have enough milk for twins if she really has twins? And does it alter her beauty? Thank you.
Please go ahead.
You talked about when the parent or the mother has twins or more than one child. If you have 2 children, what to do is that you put one baby first to the breast, it empties that breast. Then you can put the other baby on the other breast so that both children can have the benefit of all the nutrients. It should not arise the question of giving formula, not at all. Not for 3 children, not for 4 children. 2 breasts will be adequate. So the support systems where we are going to go to within the community should understand that as long as the baby is positioned correctly, attached correctly to the breast milk should suffice up to 6 months exclusively. It is very important that we do not mix feeding. We feed according to the recommendations. In most severe cases, or where there is an emergency, where there is no mother, where the mother has died, you can give formula. And then about beauty. Beauty is like a flower, it does fade, whether you breastfeed or you don't breastfeed. So you are better off breastfeeding.
Thank you, Grace. The lady in front here.
Okay, thank you very much. This whole issue of breastfeeding to me sounds like a lot of work. What can be done so that mothers do not get too tired?
Yeah, thank you very much. That's a very interesting question. Breastfeeding, for sure, as you have said, it requires actually support. It's a lot of work, and how do we support this breastfeeding mother? We are saying that we need support from the spouse. We need support from the family members. How do they support? There are a lot of chores, house chores at home that the mother is supposed to attend to, as well as breastfeeding the baby. So if you have a spouse who could help out in some of the chores that you do have at home, that will give a mother, a breastfeeding mother, a lot of time to breastfeed. The other thing that we should do is to look at the nutrition of this mother, the breastfeeding mother. If this mother is starved, you find that she won't have enough energy to do the breastfeeding. So hence the need, we are encouraging the fathers, the spouses, to provide enough food for this breastfeeding mother to eat, so that as she breastfeeds her baby, or the twins, or the triplets, she will have the energy to do the breastfeeding.
The gentleman in front, please go ahead with your question.
Thank you. I have a friend who had real difficulties in breastfeeding her baby and developed sores on the nipple. Why did that happen? And if it happens, does she have to stop breastfeeding the baby?
What usually happens is that if you are inexperienced in attaching and positioning your baby to the breast, you find that most of the young mothers, they only put the nipple, just the tip of the nipple inside the baby's mouth. That is not supposed to be the case. When you are breastfeeding your baby, to position your baby correctly, you are supposed to put the entire, or at least most of the areola. The areola is the black part of the breast. Put at least most of it in the mouth. The baby's mouth should be wide open to grasp most part of the areola. And the baby should be positioned in such a way that they are not pulling or tugging on the nipple. But if you position your baby incorrectly, or you attach the baby incorrectly to the nipple, they will be pulling on the nipple, and the nipple will get dry and cracked. So you find that most of the inexperienced mothers will have cracked nipples. That is usually very, very painful. Very importantly, the baby should not stop breastfeeding. There is another breast that is not cracked. But from the breast that is cracked, ensure that there is continuity in the production of milk, as well as you don't have to let the breast be sore. The more the milk is stored in the breast, the more engorged it will be. It will be tender and it will bring fever on the mother. And eventually the milk will stop being produced. So you don't want that to happen. What you have to do is that as you put the baby on the breast that is not affected, ensure that even the breast that is affected is being emptied frequently, and then you can just throw away the milk.
The lady in front here now.
Well, Cleopatra, as for me, I was sure that if a woman goes away from her baby for a few days without breastfeeding, that the milk goes sour. How true is that?
That's a very interesting question.
The milk does not go bad. It's okay. You can breastfeed the baby. For instance, if you go for work, there are people who go for work for 8 hours and they come back and find their children at home. They need to continue breastfeeding. That milk hasn't gone bad. So we are still emphasizing that you need to continue breastfeeding. If the mother is away from the baby, the milk that is in the breast does not go bad.
The lady in green, please go ahead with your question.
Thank you. What about when the mother becomes pregnant and she is breastfeeding? Does the milk go bad and does she have to stop?
I think that's very interesting. What happens when you get pregnant whilst you're breastfeeding?
Okay, this is one of the beliefs that we have, the myths that we have, where a pregnant woman actually is not encouraged to breastfeed when you are expecting. We are saying this is not correct. You can breastfeed when you are pregnant. What happens is that when you are pregnant, you should breastfeed up to about 7 months. Then just to give yourself the energy to come and breastfeed the baby that you are expecting to be born. Because you are pregnant and you have this other baby that you are breastfeeding, again, we have to look at the mother's nutrition. You need to give a lot of food to this mother so that she will be able to breastfeed as well as to carry the pregnancy. So we are saying we need actually to introduce the family meals gradually.
Ida and Grace, thank you so much for making an appearance on Your Health Matters Let's Talk. We've really learnt a lot on the information that you gave us on breastfeeding. Audience, did you enjoy the program? Yes. Thank you so much for your participation. Well, viewers at home, this is it. That's the program, Your Health Matters Let's Talk. Until next month at the same time. Bye-bye. God bless you.
This program is brought to you by the Ministry of Health with support from the United States Agency for International Development and its Communication Support for Health project.